My name is Rita and welcome to this next in this series of Aging with Attitude. So this is our first studio interview back since COVID, so this is kind of new to all of us again. A whole new learning curve has transpired. And just a reminder of what Aging with Attitude is. It's a show that specially targets that 45 to 64-year-old demographic and those that support them. So they could be service providers, anything to do with body, mind, and spirit. And so, it's different most days that we do this. And with me today, I've got a couple of guests. And these guests are from the PG Pelvic Floor and Core Clinic. We have Wendy Marshallowitz and Nicole Runcie. And so we're going to talk to them about their areas. It's not exactly a dinner table topic that we're going to be talking about today. So it may be something that sort of resonates with you, may not, maybe resonates with somebody you know. So with that, I'm going to start this out with Wendy. And what made you start this clinic in Prince George?
Well, when I first started here in 1998, there were no pelvic floor physiotherapists. This service wasn't offered in the north. So if you had incontinence or symptoms from prolapse, which we'll go into more, you had to wait until it was bad enough that you wanted to travel down south. So the government at that time offered a bursary to 10 physiotherapists. You had to apply in the north to fly down to BC Women's and Children's and be trained. And we trained with Pat Lieblich and Penny Wilson, and I believe Pat's still at BC Women's and Children's, and we had to train to take the basic course to be able to treat the population of the north. And so 5 years later, they flew us down, whoever was still treating, for a follow-up. There were only 3 of us. And we went in and got the latest in the research and came back to serve the population of the north. And a few years later after that, it was only me. And by the time I had finished covering a maternity leave, I had 72 people on my wait list. Which was an enormous amount. So I agreed to take some students to experience women's health and see if they liked it. Nicole happened to be one of my students, and when she graduated, I did my best to attract her from Victoria, so that was a hard sell a little bit, to the north to come and help me open this clinic to address this problem in the north.
Okay, and just curious, what are some of the things that symptoms or some of the experiences that people that might benefit from your clinic, what might they be feeling? Would they be feeling pain? Would they be feeling incontinence? What might they be feeling? And what age should people start paying attention to this?
Well, I mean, children. There's all the way from children to advanced age that it can experience these things. Pelvic pain can be a symptom. You can have just pressure in the pelvic floor. Some people experience a sneeze and squirt, right? Some people only experience it if they're crouching with a full bladder and start heavy lifting. But things like low back pain, all of these things can contribute to inhibition of the pelvic floor. And by inhibition, I just mean they're not working as well because there's inflammation and pain in the system.
So all of these incontinence products for men and women, what's the deal with that?
So I think that some of the companies have done a very good job at normalizing the incontinence experience. In the medical system, any amount of incontinence is not considered normal. So a sneeze and squirt shouldn't be ignored with a poise pad, right? We want to be able to address that, and we can address that muscularly, and you are never too old to address that as long as your nutrition is adequate to build muscle tissue.
Mm-hmm. So at what point did you introduce the whole core thing, and does that relate to what's going on in the pelvic floor?
Right, so I was lucky enough that Nicole had 15 years of experience in Pilates before she did her Master's of Physiotherapy. And so when she was coming on and she was interested in women's health, that was her big expertise to add to the whole system. So we always say you need to address the floor of your house, and then we need to address the walls of your house. And you want to do it in such a way that you are working with a practitioner aware of both. because we don't want to do things wrong and squeeze the house so the furniture goes through the floor. We don't want to bring on prolapse. And a lot of times people will be unaware that this is a major issue. For example, weightlifters, oh yeah, it's normal to pee when you lift heavy. No, it's not. And if you can't control your pee, guess what? Your organs are getting pressure and you're going to end up long-term with something like prolapse.
So what happens with prolapse? You're talking about the furniture falling through the floor. Does everything fall out?
It can, actually. There's different degrees of prolapse. So a first degree prolapse might be something as simple as when you are finished going to the washroom and you wipe and then you stand up, all of a sudden a little more dribble comes down your leg and you're like, wait, I thought I got it all. And then you're more careful next time and it still happens. But then it's, more of a second degree can be like, I've got pressure when I've been walking around on my feet all day in my pelvic floor. Sometimes I have people that come in and they say, well, sometimes when I go for a run, I get sharp pain. So there's varying degrees of prolapse and there's different organs that prolapse. It's not just the uterus in women, right? I mean, there's also the rectum, right, which can prolapse. There's also the bladder that can fall in prolapse. And this can happen to men and women.
And how do men know? Is it the same kind of symptoms or?
Many times when men come in to see us, it's because of pelvic pain. And so with pelvic pain, that could be a result of prolapse. That could also, there's a number of different things that can cause it. And so when we do that hour-long one-on-one intake, we try and find specific symptoms, and then we try to help them solve that puzzle of what's causing it and what we need to do. And we have not only our bodies in our hands, but we also have specialized equipment like real-time ultrasound or biofeedback that can actually help us see if a person's contracting their pelvic floor and measure and say, okay, well, it looks like you're doing the right movement. What's your power? And we know the population norms of where you should be to be fully continent and to be pain-free.
Mm-hmm. Interesting stuff. Well, we'll cover it in more detail later on in the interview. But with that, want to talk a little bit about the core. And, those are the walls of the house, right? We're protecting the walls of the house. What do we need to know, and how do we know if our wall is falling down?
Right. So the core is very important for structure and function in daily life. And some symptoms that someone might have if they don't have a strong, deep core, which is what we're really talking about today, they might experience back pain, hip pain. They might experience some of the things that Wendy's been talking about, different issues, pain with their pelvic floor, different issues around the abdominal wall. So for men and women, they could experience a separation or the sense of a doming happening when they're coming into a curl up or coming out of bed. These sorts of positions might activate doming, which gives evidence that there's maybe a separation in the wall. And so the idea of core training is to stimulate these important muscles that create this house, essentially, to reinitiate strength in these different areas. So the core is made up of the pelvic floor, which Wendy will go into more detail about. We spend quite a bit of time helping people with their pelvic floor. And then, so the pelvic floor is the bottom of the house. And then a muscle called the transverse abdominis wraps around the house. It attaches from the ribs to the pelvis and wraps from the front to the back. So if you think of a soup can, the pelvic floor is the bottom, the transverse abdominis wraps around. Then at the top is the diaphragm. So your breathing muscle actually affects both the pelvic floor and the transversus. And then the final core muscle that we talk about is called the multifidus. And this little muscle runs along the spine and stabilizes the spine. So the reason the core is so important in back pain and hip pain is because of its position in protecting the back and protecting the hips. And as most people have experienced, back pain is pretty common. Most of us have had some bout of back pain in our life. But as people age, there's more things that can come up. So I've got this little structure here, and in it you can see just a couple of the vertebrae of the lumbar spine coming out of the sacrum. And here you have the bones, and then in between the bones are discs. And what we want to do in life is try to keep these discs nice and squishy and voluminous so that there's a volume between them. The other thing that you have is bones that articulate on the back of the vertebrae. And what we want to do here is create space and good motion of the joint. So as you age, what can happen is arthritis in the joints and degenerative disc disease in the discs. And so what we want to work on is keeping those discs nice and tall and the spine nice and supported. So if you come from the back, the multifidus muscles run along the back of the spine. So they cinch the spine into a really stable position. The transversus muscle comes from the pelvis and it wraps around and it locks into the spine. So it's the next thing that's coming in to protect the vertebrae, protect the discs, create that length. You're always looking for length in the spine. The pelvic floor creates a lift from below, so a force going upwards, again creating this lift and length through the spine. And then the diaphragm is going up and down, it's breathing and it's affecting the contraction of both the pelvic floor and the transversus. So at any time in your life that you can start doing deep core exercises, the earlier you do it, the better. The more that you can focus on these little exercises, the more you're going to be able to protect the spine and prevent the progression of arthritis, disc disease, and some of the other things that Wendy will be talking about. The challenge with the strengthening the deep core muscles is it's a different approach to exercise. So we all love to feel a burn and feel like we're working really hard with exercise. And in most exercise programs, that's what you're going for: cardiovascular, strength-based weights. The core is this one different place where when you're turning it on effectively and you're learning to activate the deep core, you're working very detailed muscles. They're your stabilizing muscles. And so you work a lot with breathing activation and perceiving your muscle in a different way, feeling it with either your hands or your awareness in your mind. And so a lot of the work initially starts with people lying on their back and doing these deep little breathing exercises to try to turn on the deep core. And so a lot of people feel like they're not doing anything when they're working that way, but they're doing so much. So that's the big thing for people, is that they kind of jump over doing these deep little muscle exercises and go into wanting to do more strength-based things that seem effective.
And that's why it's so hard for people who are trying to learn it off the web, really, right? Without any guidance.
Exactly. And, I know a big thing too is, we are sort of concerned about, well, how we look. Like, we got this spare tire happening. We think that that's what the problem is. And if I could just get this spare tire down enough, that, the rest of it will go away too. So how does this all fit into, that aesthetic part of things, rather than just, yes, those internal muscles? It's good to know that we have them and be aware of them and mindful of what we're doing with those. But what about the external, and what about Pilates, and how does that all fit in with what you're talking about?
Yeah, so the Pilates system is really one of the first systems that was developed around World War I that addressed these deeper muscles, addressed the structure in a gentler way. So Pilates can be done on a mat, but it can also be done using machines. And both systems, both areas that you can do the Pilates technique in, provide a supportive environment. So especially with people that as they're moving into this demographic, they may have different arthritic issues, maybe sore joints, some tighter muscles. So both the machines and the floor work gives you a supportive environment to strengthen without loading the joints or causing more discomfort to the muscular system. And so the whole technique with the Pilates is to inform people how to improve their posture. And that's one of the things that the core does, is it supports nice posture, strong posture, so that when you're pushing something, pulling something, getting in and out of your car, rolling up out of bed, you have this deep supportive sling. It's the deepest part of your muscle, of your system, that's working, firing on to support you while you go through these bigger movements. And so what the Pilates system does is it allows people to practice these movements that they're going to do in daily life in a supported environment where they learn how to do them safely. So there's different machines, and the machines use springs. And the nice thing about the springs is that the nervous system and the joints are in a protective environment.
Question. These machines that you're talking about, are these things that you would find in a gym, or do you buy them, or do you have them at your clinic, or a combination of all of them?
Yeah, so we have one of them at the clinic. So I use that with my patients. And so for the Pilates, we offer one-on-one physiotherapy sessions to do Pilates training and functional rehabilitation with the machines. They're not often found in gyms. It's very hard to find them there, but you also can purchase them. And so I have had some patients who find the machines really help them get through their daily lives, return back to function, maintain body structure, maintain activity levels, that they actually bought a machine. And so I give them exercises to do on it. We review that. We make sure they're doing them right on a regular basis. And then they are at home when they can use the machines. They are expensive, but they are, in terms of what you would pay for a gym pass, or personal training, if you get the machines at a cheaper level, like you can get some that go on a wall and then have the springs coming off. It's quite affordable for longevity of your functionality, strength, and joints without impacting or creating more damage.
So what could one expect? What's the range that one could expect? Like $100 to $300, or what? What's the range?
Yeah, so there's a machine called a chair, which it looks like a box and then has a spring loaded pedal on it. That runs around $500 to $700, and there's quite a few activities you can do with that. There's a smaller apparatus called the spine corrector, and it just basically has a curved barrel with a little area to sit, and that one runs, I think we got one for about $300 for the space. Then you're moving into your two bigger machines. One's called a reformer and one's called a tower. And what the company called Balanced Body offers is this tower that attaches to the wall. And that's what we have. It fits nicely in a home. It's got all the pieces you would really need to get what you need out of it for function and strength and joint stability and core strength. And that one runs around $1,500. Then the big machine is called a reformer, and those, just financially speaking, aren't as functional. They run up to about $7,000 to $10,000. And for this demographic, there's a lot of stuff that you could use it, but you don't need it. I think the best apparatus to get is the tower, if you can afford it, and then get the training on how to use it.
But just to be clear, we don't sell these pieces of equipment. We just have them, and Nicole often will train people and then give them exercises they can mimic at home with things like bands and and a mat and that sort of thing, and that's the usual course. But people who need them long term, that's an option.
And that is really interesting, because that's oftentimes where our minds go. Well, we can get these machines or we can get them somewhere, but probably best if they just give you guys a call and get some ideas, and if they're dealing with core issues or arthritis or something like that, you've got a specialist in your facility to help them, right?
Absolutely, like a consult and discussing your goals and looking at your specific needs is the best way to go.
So with specific needs, Wendy, we were going to be talking to you about pelvic floors,
Right.
and you know, that's part of the core. I think that's part of what supports your walls. So if you would like to sort of elaborate a little bit on this pelvic floor as to what, you know, the viewers in their living rooms might be able to, you know if, you know, they need this service, and if there's something that you can create as a visual or whatever, just in words that, you know, they can pay attention to and be mindful of. Like, what do you have to say about all that?
Right, so with the pelvic floor, there's lots of variety of pelvic floor dysfunction, just like there is any other body part, right? Like with the shoulder and the different rotator cuff. With the pelvic floor, you can have something like stress incontinence, and usually that's the way that these things start to manifest themselves, is that people are going along perfectly fine unless they cough or they sneeze or they laugh really hard. And then they're noticing that they're leaking a little bit of urine. And if we ignore that, then sometimes people start to cope with that by reducing their fluid intake. They stop drinking before dinner, and they minimize it if they're going to go out to exercise. They won't drink for an hour before they go for a run. And what ends up happening then is we start sensitizing the system because we have concentrated urine and it's irritating the bladder lining. And then we get something that develops called urge incontinence. And urge incontinence happens when something irritating ends up in the bladder lining, and then before you're full, that stuff wants to get out of there, and your bladder goes, that's it, I'm not waiting till I'm full. And sometimes people are able to control that urgency, and sometimes people can't. Because we need to remember that in any form, pain and inflammation cause muscle inhibition. And that is the same with muscles in the core, just the same it is with the pelvic floor. So if you have really concentrated urine and any sort of bladder irritant in there, sometimes people say to me, I couldn't even find the muscles to clamp those muscles off. And this is even after they've come in for a bit of training. So in the process, your therapist helps you figure out what's your bladder irritants too, so that you have that information. And often people can cope with bladder irritants by staying adequately hydrated, and then they can have some of that. But figuring that out is part of the process. So often we're dealing with, if it's early stages, stress incontinence. If it's later on, we've kind of got mixed incontinence. And then we can also develop pelvic pain, right? Because muscle inhibition will stop the core and the pelvic floor. So there's a number of different things, and your therapist helps you sort that out. The muscular sling that Nicole was talking about is, it goes from side to side, and it also goes from front to back. And so there are a number of different loops. So anyone who's been exposed to something called Kegels, which was invented, I think, in 1948, and that was, the instructions for Kegels is pull everything up, hold as hard as you can for 10 seconds. If you're lucky and you've had the information, they sometimes tell you to breathe. And then you're supposed to drop everything as fast as you can. So the problem with that is that if you actually develop a strong enough muscle contraction, when you drop it suddenly, you actually set off a spinal reflex that tells your muscle around your bladder, okay, I've dropped my pelvic floor, it's time to empty. And so then you get this strong contraction of your detrusor muscle, whether or not it's the right time, right? So when you come in and talk to your therapist, we help you remap your pelvic floor and find out the proper cues that work for you specifically, back, middle, and front. One of the problems that I have when patients come in, I've had people come in and said, I've done Kegels for 2 years. Why am I still peeing my pants, right? And so part of the problem is, like Nicole was saying, that your brain likes the satisfaction of a strong contraction. And the biggest muscle, which is the first one that's innervated at the back, often stays strong, even when the front ones are weakened. And so often you will think you're contracting the right muscles, and you're just contracting one muscle loop. And so that's the problem. So we help you remap, figure out where all the loops are, figure out the coordination, and then we have to address things like fast and slow twitch, which sounds a little complicated, but really what it is fast twitch is like your biceps that moves fast to catch a ball, but boy, you sure don't want to keep that arm up there long. And slow twitch are like your abdominals, where they have to be on all day, but maybe they take a little longer to turn on. And we we need that balance because the fast twitch muscles are the ones that help us with the cough or the sneeze, and the slow twitch muscles are the ones that help us walk around against gravity and support all our organs. So it's much more complicated than 1948 Kegels.
Well,
is my summary.
We've gotten assigned to sort of wind down a little bit here. So very important stuff. And as I say, it's not exactly dinner table conversation. And, and we do have this resource in Prince George. So in our final wrap-ups, anything that we forgot to say, or that if there was one little tidbit, one little nugget that people should remember about what we talked about today, do either of you have one little nugget or two little nuggets, one each maybe?
My nugget would be to start young. If you're a young person who is thinking about starting a family, come in and learn about your pelvic floor muscles before you have a baby, before major changes, before operations even, because you're making that neuromuscular link, and it makes rehab easier, just like it would with a knee, right? And then postpartum, and then anytime you've had any sort of trauma, if you've undergone a hysterectomy, get in there, remap it. You're going to prevent further prolapses. It's not just the uterus that prolapses, other things prolapse too. So overall pelvic health, it's a continuum through your life.
Mm-hmm. Nicole, any quick nugget?
Yeah, I think really the big piece with the core and the Pilates is that it's a nice addition to what you're already doing to stay functioning and to live an active life. So you don't have to do it all the time, but it's a technique that you can learn. It's really easy to learn. We make it as easy as possible at the clinic. And like Wendy said, we offer home everything that we do in the session, you can do at home in a certain way. And so just making sure that you add that to your training program.
Okay, so that's a very interesting topic of discussion. And there in the Phoenix Medical Building, you may have to talk to your doctor about a referral. I'm not exactly sure of the process of that. But, as we're just wrapping down in our final few seconds, I want to thank my guests, Nicole and Wendy. And thank you, the viewers, for joining us for this next in this session of Aging with Attitude. Until next time, I'm Rita Weeb. Thank you.